I'd like to call to order the Fitch-Rona EMS Commission meeting at 7:01. Start out with roll call.
All right, Strassman. Hilla.
Here.
Roberts.
Here.
Cronin.
Present.
Johnson.
Here.
Kaiser McHenry.
Here.
Lonsdorf.
Here.
Lugenbull.
Here.
Anderson.
Here.
Desteler. Okay.
Thank you. Next on the agenda is public comment.
I did not get any public comment.
Sounds good. Moving to the next item, which was the swearing in ceremony. And due to a schedule conflict, we needed to make a change. So we'll try that again next month. Then next item is the review and approval of the meeting minutes for March 16th. So first off, any questions, any corrections, any comments on those minutes?
No.
Is there a motion to approve?
I make a motion to approve the minutes from last month.
Thank you. Then we'll move to vote. All in favor of approving the minutes from March 16th, signify by saying aye.
Aye.
Any opposed, say nay. Motion passes. Moving on to the chief's report.
Sure. So I have it up on the screen there to share. I think almost everybody's out of the picture there. So you did get this emailed to you. The usual that's up there is our calls for service. Again, about 19% over the year before. So currently tracking for 23% increase over last year, which will put us at about 5,300 calls for the year, which is unanticipated high amount. So, you know, the question usually gets asked, is it anything specific? Have not been able to track it down to anything specific. I did pull the numbers for New Fitchburg at the Old Town area, and it's about what we thought it would be. It's about 300. We're on track for about 350 some calls there. So it has been a little bit higher than anticipated, but not that 23%. So I don't know, other than keeps going up. The rest of the numbers there that you normally see are there. Again, noting the March 15 times in March, all 3 ambulances were out, and we increased our mutual aid year to date to 7. So in just the first 3 months of the year, there was 7 times. Of those 15 times just in March, but 7 times since the beginning of the year where all of our ambulances were out, and we required another ambulance department. The city of Madison, I think, was all but one to come into our department, to our district. So, yeah, currently looking at about 13 some calls a day split between the 3 ambulances. I like to point out that's the average, which means it's usually somewhere between like 4 and 30. So it's the unpredictable nature of what we do. As far as our consortium training this month, it was actually on some pediatric emergencies with Dr. Kim. I just forgot to get that typed in there. And then we did our run review last week, or actually earlier this week, with Dr. Mancera, who's our medical director. He does our case reviews and then did some stuff with some substance withdrawals. So it was a good review for us this month. Our usual stats that are there for our days of the week, hour of the day, calls by municipalities, reasons for dispatch. This is covered up on my sheet, but you can see it on the sheet down there. Between the 3 different stations, that estimated station 2 is still largely our busiest station, with station number 3 creeping up pretty quickly with the new Fitchburg up there. There's our aging report. As you can see, everything except for that very last number, that 180 days out, still continues to creep up. I did share that last month, right? There's some new requirements for reporting on those calls that go to the collection agency. That's taking a little bit longer. So Brad, who's our representative at our billing company, is very aware that we're keeping an eye on that. Otherwise, all the rest of those numbers are there. You can see our cash on hand. By the end of March, there was a little bit of a hiccup in the processing of the CD I had mentioned last month. So we did take another $100,000 out of that unassigned balance, and part of that was the funding from the city of Fitchburg. I'm sorry, not the city of Fitchburg, but from all the 3 municipalities in our budget item to increase our reserve. So that did get pulled with some of the funding that was sitting in the unassigned balance for another CD, and it didn't get processed by the end of March. We still did get the rate that they were offering, but that you'll see that next month. That posted, I think, earlier this week or the end of last week. So the funds are still there; they're just not designated. You can see our assigned balances in there, so we still have our FAP funding. Some of the expenditure that was in there was from some of the EMTs that we've been sponsoring from the fire departments, as well as the ARPA funds are still sitting there waiting for some equipment to get, same thing with our EPIC grant, waiting for that equipment to ship. And then you just see our WISC balance just continues to accrue interest in there. No additional March donations. April was actually a slow month for hiring in the past. We did actually hire 4 new LTEs this month that they'll start their milestones, but nothing new to report there. At the bottom of the sheet, you'll actually see earlier in the week met with the CIP presentation with the city of Fitchburg. I will work with Fitch-Rona, I think next month as far as the presentation. But the new mayor up in Fitchburg, as we kind of was sharing some information about what's going on here and some of our CIP stuff, had actually requested just a short little narrative at the bottom of the chief's report with some of the items that we talk about here that don't always get passed on to council. So I just added another little updates area for just some information to make sure that everybody's kind of the topics that are going on there, noting that the replacement ambulance that we were supposed to get this year is still on track for being replaced next year, July of 2024. We'll talk about that a little bit when we get to CIP. Other really operational things that just sharing to, I guess, just to make you aware of as the request was to share information. We've been seeing it forever. I guess the pandemic pushed a lot of it, but we're still seeing, so ketamine and etomidate, which are some pretty significant drugs in some of the procedures that we use, big shortage of them, and we're finally tapped out to, we are out of some of them, which just forced a protocol change with our medical direction. So it's not compromising patient care. We still have access to other medications that are not medications that work. These work better than those. The other medications still work. So it's just kind of forced some protocol changes with us and a little bit of follow up with our staff just to brush the dust off some of the stuff that we used to use in lieu of those drugs. The EPIC grant, submitting for that for some consideration for point of care ultrasound. So that's probably something I'll just talk about in the future as that moves forward. At the state of Wisconsin level, so it is what you think it is. It's actually a little portable ultrasound wand, plugs into a tablet. As of right now, the scope of practice in the state of Wisconsin is actually just to verify the lack of cardiac function. So when we have a patient who's in a cardiac arrest and we put our CPR device on them, sometimes it can be hard to feel pulses on those patients. This actually allows you to actually pull out an ultrasound and actually see that there is cardiac function or there's not cardiac function that you may or may not have been able to feel. That's the limit to the scope of practice now. However, if you can think about what ultrasound does, there's an infinitesimal opportunities that we're hoping to kind of get in front of. Lots of training, very robust training that will need to occur with this. So working with our doctor, Dr. Mancera, as well as UW and a handful of other people to try to put something in place that should we get this grant for point of care ultrasound, we'll actually be able to put that on our trucks and hopefully do some phenomenal things with that. Part of the ARPA funds and last year's EPIC grant was to purchase power stair chairs and a new cot. Those are all on back order like everything else in the world. The draft audit was received. I actually don't remember if I sent that out to you today. I actually got the real audit 2 days ago, which I emailed out to you. Brett from Johnson Block will be here next month to do a quick review of that. And then, as I mentioned with our milestones, we got 4 new LTEs who have started their onboarding process. I think one of them has got his last day coming up, I think, this week, and then the other 3 should be done by the end of the month to kind of help start to alleviate some of those significant open shifts that we have. That's what I have as far as the chief's report. I'll pull up the in-house operating budget. I'll share that.
Before we move on, so like, I was just sort of curious, like in the hiring the LTEs, how do you attract talent? Like, do you have open positions and people apply?
Yes, we've had to. We've recently just changed it, so it's a process for applications. So we collect resumes, and we usually kind of collect them over a period of time. Historically, there's been huge applications, so we really just did 1 or 2 times a year. We would take all of them together. They come in and do a written test for us that's been validated from the school, from MATC. They do a skills test, so we run them through a patient care scenario. They do a physical agility test, and that was under when we had Lieutenant Wells here, did quite a bit of research to develop a physical agility test that was focused on EMS. That's posted on our website if you ever want to see what that actually entails. And we do a panel interview and a chief's interview. So yeah, we used to do just 2 hirings a year based on the batches of applications we got. Now with that shrinking pool of part-timers that I keep bringing up, that we're all fighting for that same group of people, we have really just now started doing kind of an as they come in. So this last group we had over about a course of a month and a half-ish. We had those 4. We put it out on the website, put it out on social media that we were looking for people. We got those 4 applicants. And I think kind of our plan in the future now is to just do them as they come in. I think we had 6 applicants. One of them did not pass the physical agility test. And then, as you can imagine, trying to onboard 4 people all at the same time. Our onboarding process is still a work in progress, but they do 3 days of riding as a third, kind of getting adjusted. Most of the time, it's not their medicine. Most of the time they come in as solid paramedics. It's really, if they don't work in Dane County, it's kind of, the unique Dane County way of doing things, as well as our area, our district, the common places we go. We have an orientation checklist. But I think that was the long answer to onboarding LTEs.
That's helpful, thank you.
Any other questions on the other information? Otherwise, presenting to you the in-house budget, the numbers I always look at, right? We're 24.7% through the year. Let me find my document so I can scroll down. As far as expenditures go, some are high, some are low. I always compare the top to the bottom. We're 24.7% through the year, and we've expended 25% of our budget. So we're where we should be. Unless any of those numbers stuck out crazy to anybody. That's what I have for the chief's report.
I forget, do we approve this? No, just move on. All right, so moving on to the chair's reports. So the personnel subcommittee didn't meet because we didn't have quorum. Again, I apologize for that. So personnel didn't meet. Finance committee met before this meeting. So, would you like to give a report?
Yeah. We met and discussed a couple of items, which I think we'll be bringing up in a minute, but we recommended the holiday vacation, personal day, sick leave, and other benefit policy. We discussed longevity pay and neither recommended nor didn't recommend it. We wanted to have more time to think about it. And then we also listened to a presentation about the CIP budget, and we'll talk about that more, I think, in a minute.
So I guess so the longevity pay was on, I'm trying to think that would have been on, so it was on the agenda for both for both
Personnel and
subcommittees. Yeah, but I just threw it up there in a nutshell. I can give you what that is. About 6 months ago, we asked part of the discussion of developing the budget for this 2023 was looking at the non-represented staff, that there's longevity that exists for represented staff in the collective bargaining agreement. Longevity pay actually also exists in the city of Verona, non-represented staff, and it exists in a little bit of a different format in the city of Fitchburg. So develop this policy. The policy here would not take into effect until January of next year because it's not a budgeted item, but brought it to the two committees. And then, so personnel didn't meet. And then, as Dr. Lonsdorf mentioned, finance wants to take another look at it. It wouldn't take effect until January of next year. So the only timeline we're really looking at this is if it is approved of getting it in the 2024 operating budget. So the recommendation was to table it until next month.
So if somebody has a question about it between now and next finance committee, they should probably start with you, talk to you.
Yep, I was given some homework to go back and bring back to either the subcommittee or the full committee next month with some questions.
Good. Any questions or comment about that for now? No.
So for record-keeping purposes, Michelle, it's tabled.
Moving on to the next agenda item, which is review and possible action on a policy, holidays, vacation, personal days, sick leave, and other benefits, non-represented staff.
So you'll see the highlights in red. As part of the collective bargaining process last year that was implemented this year for the represented staff, 2 additional holidays were added for the represented staff, and that would have been Martin Luther King Day and Juneteenth as paid, recognized paid holidays. So the update to the policy here is actually just to add those paid holidays to the non-represented staff policy as well. I guess, do you want to share, Dr. Lonsdorf, what your discussion was?
Well, there really wasn't much discussion. These are just 2 holidays that were being added to the list of holidays that are given to employees, basically. And it's part of, and the union people all get them, and so the thought was the administrative staff should too.
Juneteenth is also recognized by the city of Verona and the city of Fitchburg as paid holidays.
Yeah.
So it's actually would be in line with at least 2 of our 3 municipalities.
Yeah.
Any question about these modifications to this policy? Comments? Hearing none, is there a motion to approve this policy?
I'll move.
Is there a second?
Second.
Then we'll move to vote. All in favor of approving the policy as shown, please signify by saying aye.
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 All opposed, say nay. Motion passes. All right. Next agenda, review and possible action on policy, equal employment opportunity.
Sure. So as a process improvement, started about the middle of last year, we have a records management system internally that allows us to review policy. So now I actually have all of the policies that I look at every month and either update them or just make a note that they're approved reviewed or need some updating. So this was actually the one I would have looked at last month in March, equal opportunity in hiring practices. I did reach out to Sarah Olson from the city of Fitchburg and just asked for a copy had her look at it. It hadn't been updated since 2006, so a handful of years have gone by since this has been looked at or updated. So there's a couple of new protected or recommended protected classes to put in our equal opportunity policy. So it's really, as I just said, it's really as a housekeeping update to stay current with current federal language.
Any questions, comments? Seeing none, is there a motion to approve these changes?
So moved.
Is there a second?
I'll second.
All in favor, say aye.
Aye.
All opposed,
Aye.
nay. Motion passes. Next up on the agenda is review and possible action on the job description, Deputy Chief of Operations.
Sure. So this was distributed to you. I'm pretty sure I put it in your packet. As we've kind of talked about the last couple of years, and will be in the operational budget, which we won't see for about 2 more months-ish. The request would be for a second deputy chief starting next year. We've talked about it in the past. As far as myself and Jeff, at least the current chief is 1 deputy chief. We've truly reached the capacity of what we are able to do as fast as our system is growing. Looking for a second deputy chief next year, and then we would divide those duties between an EMS chief of operations and a deputy EMS chief of administration. This is actually what the structure looked like when Chief Merlin was here. He was the part-time chief, and then Jeff and I filled those 2 deputy chief roles. So we actually just blew the dust off of what the old one looked like, and then just updated it with kind of some formatting to match our current ones, and then it's listed here. It is a job description that usually does get approved through personnel or for the full commission here. I bring it up here because, again, it'll be in our budget for next year, which will get presented here in the next 2 months or so, and then it'll go through that process. So just trying to start the ball rolling to make sure we have something in place that I'm asking for. So I guess if you want to take a look at it, if you want to, I know personnel, they don't know if they wanted to, because they didn't meet, they can look at it again next month or bring some suggestions back. I mean, it's truly a living document.
I think to review what you said, we don't have to take action tonight. This would be a discussion, or?
You know, I believe historically we have actually approved job descriptions.
Okay. So then we'll open it up for review, comments, questions. And to review, you said this position, ideally you would fill when?
It would be starting January of next year.
In the new budget.
In the new budget year, providing it is approved by the municipalities.
And after, assuming we approve tonight, then what happens? Do you have to go to the?
So it'll just make its way into the, it'll just be part of the operational budget changes.
Okay.
So yeah, all this is just creating the structure of having a job description and a job position in place, so that providing it gets through the budget process, we are ready to flip the switch and start the hiring process. So it's just out here getting it done early.
Good. Any comments or questions? Is there a motion to approve this job description?
I would make a motion to approve the job description.
I'll second.
Thank you. Then I'll move to vote. All in favor signify by saying aye. Aye.
Aye.
Aye.
All opposed? Nay. The motion passes. Next up is review and approval of accounts payable checks authorized by the chief. Which was in the packet that you emailed out, so.
Correct.
You're not flashing them on screen.
I'm not. I do have a paper copy if anyone sitting here wants to take a look at them.
So
and
did anybody have any questions for the chief about the checks, the accounts payable checks? Seeing none, is there a motion to approve?
I'll make a motion to approve.
Second? Is there a motion for a second? Second, please. There's a second. Then move to vote. All in favor of approval of the accounts payable checks, please signify by saying aye.
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 All opposed, nay. The motion passes. All right, we're on to discussion and possible action on the 2024 CIP, Capital Improvement Project budget.
All right, so I'll give you the narrative in a nutshell there. There's no huge changes from what we've asked for in the past. It's between the City of Fitchburg and City of Verona, they kind of work on somewhere between a 5 and 10 year CAP process. So looking at the years ahead, we exist as it's referred to essentially as a fleet maintenance or fleet replacement program. Every 2 years, we purchase an ambulance. We keep that ambulance for 10 years. The capital purchase we have includes the ambulance and then most of the durable items that exist inside that ambulance. I've listed them out here, the examples: the cardiac monitor, the cot, the auto loading system, the ventilator, some of the radios, and the tablets. So we kind of consider most of those things, with the exception of those tablets, have about a 10-year lifespan. So we just replace all of that stuff every 10 years with the ambulance. So as opposed to Verona's been doing it for a while, Fitchburg started, and the town of Verona actually started doing it a handful of years ago to prevent these big spikes in borrowing, because normally we purchased an ambulance every 2 years, so every other year we didn't ask for anything. So to prevent those big spikes, created the fleet replacement program, essentially made that number, took roughly half of it every year plus whatever that cost of inflation was, and made the request for every year of a certain dollar amount. And that's what you see here. We just have to submit it every year with noting what that increase is. One of the things to note in this year's CIP process is, so 2023 would have been a replacement year. Due to sourcing and supply and demand, we're actually not going to see that ambulance until next year. So there's a little bit of a borrowing there. I have essentially pushing it late and then potentially borrowing early. I have shared all of that with our with our finance directors at both cities, and we'll be reaching in with the town as well to kind of explain all of kind of how it works. They're both aware of it and believe it will work. Their request is just to ask like we have continually asked for, and that's just moving those funds as you see there. But that number has to be sent to the municipalities. It's in Fitchburg as of 2 weeks ago, and the Verona's coming up here. We'll also, looking in here, as we've asked in the past, is to actually increase the fleet then in 2024 to a 6th ambulance, kind of with the anticipation of actually putting another ambulance on the street in 2025 based on call volume. So that's it in a nutshell. We did talk about it at finance. I don't know if Dr. Lonsdorf wants to kind of give a summary of what you did there.
Well, we discussed it, and essentially what Patrick said, it's a little bit complicated, but a new ambulance costing about $400,000 comes online about every 2 years. And because of supply problems, the process is a little bit delayed. The other interesting thing we talked about is oncoming electric ambulances, which are, I guess, available in Canada, and possibly Madison has one or is ordered one, I guess.
On the list to get one.
On the list, yeah. And they're significantly more expensive at this point, and so this 10-year projection will obviously get changed somewhere around 7-8 years out as gas-powered ambulances go away and electric ambulances become more common. But that's essentially what we discussed. So,
I thought it was interesting to add to that. It was interesting that you mentioned too that it may seem obvious, but it wasn't until you really said it that with an electric ambulance there's an infrastructure need too, and we're working on all of that in Madison and Dane County. So it's all in process.
Yeah, it's coming.
yeah, do you want to mention? I thought it was interesting. The ambulances are not plug-in electric vehicles; they sit on a big pad.
Correct.
There would be one at the hospital and one at the ambulance or at the stations.
Yep. So currently, Quebec has been the model out there that for this that most people are for that one, at least that I'm familiar with. And yeah, I would look at it. Your ambulance is a gigantic iPhone, so it actually charges off of a mat. It doesn't plug in. So the hospitals would have mats. So when you dropped off a patient, it would be charging. When you come back to your station, you park on the mat. So it's constantly charging when you're stopped and dropping off patients and doing things. The technology is out there, man. It will be getting better. But like you said, as of right now, it comes with a pretty significant cost. But they're in production in the U.S.
And there would be no gas charges, which is a significant cost, and also less moving parts. So there'd be a lot less maintenance
No
charges.
oil changes, no blown radiators.
Yeah, all that stuff. Yeah. So interesting, not relevant to current discussion, though.
Sure, but I guess if you want to give us the recommendation to approve.
Well, yeah, we recommended approving this as it's written.
To approve as a full committee then, right?
Yep, you'll approve for submission. So the process still has to go through the normal CIP process of all 3 municipalities. So you're approving this for submission to the municipalities for approval through the normal approval process. Michelle got all that written down.
Is there a motion to approve what the chief just said?
I'll move approval.
Is there a second?
I'll second.
All right, we'll move to vote. All in favor, as stated by the chief, please signify by saying aye.
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 Anyone opposed, please say nay. The motion passes. All right, so next up is other business. Is there other business?
I guess the only other note I have is Jim Wheeler. I don't know if you plan on coming up here tonight. We actually have a new representative from the city of Fitchburg. Not official yet. Did you want to come up and say hi to anything or introduce yourself? I'm sure one of us probably took your spot up here.
Yeah, that's okay. I'm flexible. So I'm Jim Wheeler. I'm an alder for District 4, City of Fitchburg. I'm a retired police officer after 28 years with the City of Madison Police Department. Married with 2 boys, a 25-year-old and a 21-year-old. One is at the UW right now, should be graduating next year. And the other one has graduated and he's in Milwaukee. So I think this is a great opportunity that I like to learn. So I'm, glad to be here. So.
Thank you. Welcome. We've connected to get him all oriented to the complicated world of EMS operations.
It'll be a good addition.
Oh, thank you.
Welcome.
He just has to memorize your CIP explanation. It's stated. All right, thank you. Any other business? Hearing none, then is there a motion to adjourn?
I'll make a motion to adjourn.
Is there a second?
And I will second.
All in favor? Aye. Anyone opposed? All right, thank you.